Hello, thank you for joining us today. Welcome to the University of Houston College of Pharmacy Why UHCOP series. Today, what we're going to talk about is the faculty perspective of University of Houston, the profession of pharmacy, and other specialties about pharmacy. So right now, I'll have Dr. Wanat introduce himself and tell you a little bit about where he went to school and what he's interested in.
So hi, everyone. My name is Matt Wanat. I'm a clinical associate professor here at the college. So I grew up in the Northeast. I grew up in Connecticut. I never thought when I was, grown up or down the road that I'd live in Texas, but here I am and I love it. So I went to school at Northeastern University in Boston, Mass. And I actually met my wife in pharmacy school there. She's from Sugar Land, Texas. So, she said the people in Boston are mean. She hated the cold weather. So she said, we're going back down to Texas after school. So I looked at residency programs both in Boston and in Houston. And after I graduated, I actually matched with Houston Methodist Hospital right in the Texas Medical Center. So after pharmacy school, after getting my PharmD, I did a PGY1 pharmacy residency, a postgraduate year one residency at Houston Methodist Hospital. And then I stayed on and did a second year, a postgraduate year two critical care specialty residency. And after I finished residency, there was a position that opened up at UH, a faculty position for a clinical faculty member, and it had a specialty of critical care. So I got to interact a lot during residency with UH faculty and staff and really got to know the students and, was really impressed by the program that UH had. So I applied for that position. The timing kind of worked out really well. And that was in 2012. So I've been a faculty member at the college now for 9 years.
That's really cool. Let's back it up a little bit and go into why you even chose pharmacy in the first place. What was it about the profession that drew you in?
Yeah, so that's a really good question. I was interested in the sciences. I also interested in the medical field. I knew there was a lot of opportunities. Took a class in high school that pointed me towards the medical field and got opportunity to talk to different people in different professions and had an uncle that was a pharmacist and just really liked the different opportunities in pharmacy. You're not just tied to the community setting. There's hospital pharmacy, there's academia, which I do right now. There's industry pharmacy, there's compounding pharmacy, there's long-term care pharmacy, a lot of different opportunities. So, I felt like I could have an impact on patients and also have an opportunity to practice in, different areas, depending on, as I got into school, what my interests were. So, pharmacy checked a lot of the boxes for me, being able to help patients in the medical field, and I was really good with science and healthcare related topics.
Well, let's talk about your specialty for just a moment. Tell us what is your day-to-day, because you are a clinical pharmacist, is that correct? And you're an academic pharmacist as well, if that has an actual definition,
Yeah.
but you're in academia. So you teach your students in your clinical side. What does that look like for you every day?
Yeah, so for me, it's really a mix between, probably about 50% of my time is patient care in the critical care setting where I practice. And when I'm there, I bring students, I bring residents. So, a lot of the incoming students would have an opportunity to do a rotation with me in the cardiac intensive care unit. So I practice in the cardiac ICU at the VA in Houston. And then the other half of my time is really split teaching students, interacting with them, mentoring them, and also doing research at the college as well. So, a lot of our clinical faculty are essentially our pharmacy practice faculty. In order to be able to teach you guys the most up-to-date stuff, we have to be practicing. So we're, for the most part, split between actually being practicing pharmacists and the other half teaching and doing some research at the university.
So what do you enjoy most about your job?
I think it's definitely the student interaction and, seeing student success. I think, largely the reason why I went into academia was a couple mentors that had a huge impact on me that really motivated me, saw me to see the best in myself and what I can be. So I think, when the students are able to see that or get motivated or, sort of find their place, and then you see them, graduate and match into residency and get great jobs. And, you see them win these awards down the road. I think that's the biggest satisfaction, is seeing all the great stuff that our UH grads and alums do. And I have to tell you, we're all over. Our students are doing great things. Recently with all obviously the COVID pandemic and what's going on, a lot of our alums are the folks leading these massive immunization drives and, really having a big public health impact. So I'm super proud of being a small part of what our students accomplish.
That's amazing. And the students love you too. So this is, I think it goes hand in hand. It works well together. So what advice would you like to leave with a pre-pharmacy student who wants to pursue pharmacy? What would you tell them to encourage them to move forward into the profession?
Yeah, I think, we're looking for dynamic people. So obviously we want you to excel academically. We want you to have good grades. But we also want people that have great communication skills, people that, ultimately you have to want to help patients as well. That's one of the main reasons for going into this profession. So I think it's a good idea. Pharmacy school is tough. It's a tough 4 years, but once you have that doctor of pharmacy degree, there's a lot of different things you can do. So, if you're applying, you're interested in coming, try to get a job in a pharmacy or shadow a pharmacist or reach out to some of the faculty members to hear a little bit more about what we do, because it's definitely a big commitment. And once you're here, it's a rigorous program because, we have to prepare you well to take care of people. You could be taking care of my family, your family. So that's really important. But once you have that degree, there's a lot of different things you can do. So it's definitely worth it. But it's definitely a challenge because we're one of the most trusted healthcare providers,
Awesome. Well, I think that's a really good bit of advice for our students who are interested. And thank you so much for your time. And that concludes this video series with Dr. Matthew Wanat. And we are talking about why UHCOP. So thanks,
Awesome.
Dr. Wanat. Have a good day.
Go Cougs.